Policy and Law in Healthcare, Deanne Waterman, Colorado Christian University. Policy and law in healthcare has a wide-reaching impact on all members of society. Policy and law determines how healthcare is practiced, regulates insurance programs, regulates prescription drugs, and improves access and quality to healthcare. At times, policy and law may seem to be against what society as a whole is wanting or needing. This is due to the need of policy and law to achieve a balance that works for both public and private sectors involved in healthcare. Regardless of how one may view the outcome, policy and law is in place to protect and promote the health and well-being of society. Health policy and law lends itself to society's access to health care. These policies and laws determine the type of care received, how easily one is able to access health care, as well as payment for care by those who are insured or uninsured. Showalter tells us that policy and law create relationships between people and the healthcare field. These include various state and federal laws that provide legal rights in healthcare, such as the statutory right to be seen and have conditions stabilized. And this helps to determine if one has the legal right to healthcare depending upon their circumstances. For example, certain poor, disabled, and elderly persons have a statutory right to governmental financial assistance for health care services. An article in the Indian Journal of Community Health shows exactly the same issues, as these issues are not bound by borders of states, countries, or even continents. Healthcare policy and law is there to help protect the populations. In fact, inadequate policy and public healthcare systems lead to high out-of-pocket payments, which generally leads to people opting out of medical treatment. This will only further exacerbate poverty and mortality rates among the already marginalized and poverty-stricken. One of the greatest impacts of the healthcare policy and law in today's society is seen in the Affordable Care Act, also known as ACA or Obamacare. This law expanded health insurance coverage to as many as 32 million Americans that were previously uninsured. This law was intended to slow the rising health care costs, improve the quality of care for all, and provide greater access to affordable insurance for all. ACA provided provisions to preserve Children's Health Insurance Program, CHIP, required parental insurance policies to allow dependent coverage until the age of 26, and prohibited denial of coverage based on pre-existing conditions. Overall, the main aspect of health policy and law in today's society is to make health care widely available and affordable for all Americans. Oftentimes, people have felt that the ACA is just a massive power grab by the federal government. Many felt that the ACA, like many federal laws, was a power struggle between the Republicans and Democrats. This still seems to be an issue between the two political parties. Often, healthcare-related policies and laws fall into this power struggle, as they are such a large concern for all Americans. Another issue with the healthcare policies and laws is the long implementation guidelines. As each side of Congress fought out the particulars of the ACA, as with any healthcare policy or law, each side fought out the implementation but also attempted to defer to states to implement projects and pilot programs. Another issue that arises is fraud, waste, and abuse from healthcare policy and law. This fraud, waste, and abuse may come in the form of issues that arise in the creation of the policies and laws, but also can come to fruition through the use. Through laws such as Medicare and Medicaid, there can be copious amounts of fraud, waste, and abuse. In fact, in July 2017, the U.S. Department of Health and Human Services announced the largest healthcare fraud sting, charging 412 individuals with $1.3 billion in false billings to Medicare and Medicaid, also citing exclusions from the Office of Inspector General to 57 doctors, 162 nurses, and 36 pharmacists. When it comes to creating laws and policies that help facilitate healthcare coverage, this can open the government to issues of fraud, waste, and abuse. Finally, budgetary issues arise when the government helps with healthcare policy and law. Through setting up policies and laws for healthcare, this requires so much more than just policy. The ACA required amended insurance codes, expanding of Medicaid, testing alternatives to malpractice litigation, among many other issues. The cost associated with healthcare policy and laws can be astronomical, although worthwhile, especially in the long term. Policy making is needed to ensure the health needs of society are recognized and receive the attention necessary to prioritize the areas of highest concern. Policy making is needed to create partnerships involving government and healthcare in order to make the best use of available resources. Maximizing resources and prioritizing the health needs of society will ensure society as a whole has access to much needed quality health care. He changes times and seasons. He deposes kings and raises up others. He gives wisdom to the wise and knowledge to the discerning. Daniel 2:12. This verse stands as a reminder that the work of our policymakers is guided by our Lord. It is our responsibility to know who the people are that we choose to represent us. We must use our faith and knowledge to choose those who will use the wisdom they are given to make policy and law that will best serve society. Healthcare policy in today's society is the forefront of the new time and time again because this affects everyone. Healthcare's role in society is great, especially because it is in the forefront of so much. Through the Affordable Care Act and Medicaid and Medicare, the role of healthcare policy and law is to make healthcare available to all. While there are multitudes of problems with healthcare policy and law, including the power grab by federal government, long implementation guidelines, fraud, waste, and abuse, the budgetary issues, healthcare policy and law is needed. Healthcare policy is needed to prioritize the healthcare needs of society, provide for the best use of available resources, specifically time and money, and to ensure that society as a whole has access to healthcare. So despite the problems that arise from public policy to healthcare, it is needed for the betterment of society as a whole, especially for the marginalized and poverty-stricken.